Good morning and thank you for joining us today. My name is Dr. Wajid Ahmed and I'm the Medical Officer of Health for Windsor-Essex. Teresa is not in here today. I will now report our case counts. We now have a total of 10,665 cases, an increase of 171 cases from yesterday. Of the 171 new cases, 14 are outbreak related, 10 are close contact of confirmed cases, 4 are community spread, 1 is travel outside of North America, and 142 cases are still being investigated. We have 2,721 cases that are currently active, and 7,696 cases have resolved. Our community has lost 248 people as a result of COVID, an increase of 7 more deaths from yesterday. Of these 7 new deaths, 5 are from long-term care home, a woman in her 60s, 2 women in their 80s, and a man and a woman in their 90s. 2 of the new deaths are from the community, a man in his 60s and a man in his 70s. I want to take a moment to pause and send my condolences to the family who lost their loved ones. At present, we have 121 cases that are currently hospitalized, 19 are in ICU, and there are 183 suspected cases of COVID in our hospitals. There are 45 active COVID-19 outbreaks in Windsor-Essex, 20 of them in long-term care home and retirement home, 21 in workplaces, 3 in hospitals, and 1 in the community. I will now start our weekly epi summary. Okay, next slide. So quick look at what's happening around the world and what we can see how each of these countries are seeing a surge in cases. And as we have talked about many different measures and the importance of putting those measures right at the right time in place, and also about what's happening locally. So we have seen a huge surge in cases in France, and then now we're seeing a huge surge in UK with the new variant strain that they're finding, that is leading to more cases in the region. So right now, as of today, United Kingdom has the most new daily confirmed cases per million of population in the world, even surpassing the case rates in US. Next slide, please. Looking at the number of people who are dying around the world, similar picture with more cases. As we know, there are more deaths. And similarly, what we are noticing is right now the highest number of daily deaths that are seen is in UK and then Sweden, followed by US and Canada. Overall, if you're looking at the cases in terms of daily case, in terms of daily death rates, has been relatively stable for the most part compared to many of the other developing countries. Next slide, please. Focusing just on Ontario, as we have talked about recently, that Ontario continues to see that surge in new cases and daily cases that are increasing, sometimes touching close to 4,000, seeing some minor decline in the last few days, and we are hoping that that trend will continue based on the new measures that has been put in place. Next slide, please. Focusing in just Windsor-Essex, and as we can see that Windsor-Essex has seen the increased number of cases in a very short period of time, and somewhat we're seeing that maybe we have hit our peak at this time, but it may still be too early. We're hopeful that with all the measures, all the restrictions that are put in place since December, when our region went into lockdown, that these cases should stabilize at this time and then start to show a decline in the overall cases in the community. Next slide. Trying to look at it differently in terms of the cumulative cases, and as we've talked about this graph, and the best way to interpret this graph is to look at the steepness of the curve, and as we can see that we have seen a huge number of cases in such a short period of time with a very steep curve that is right in front of us. Next slide, please. Focusing just on the death, similar picture. We had a pretty good run with respect to the number of people who lost their lives as a result of COVID, and now we are seeing another increase, and part of that increase is also linked very easily with the number of cases that we are seeing. And we have said it again and again, the more cases, more people getting hospitalized, more people dying, and it's also reflected in the data, what we are presenting here. Next slide. Comparing our cases, weekly case rates, that's one of the measures that the province use, and to look at an overall picture of how, as a region, we are doing, and to compensate for the day-to-day variation. So this weekly case rate, as we can see, this week's our case rate is 309 cases per 100,000 population, and this is slightly decreased from where we were before last week, when our case rate was 340 cases per 100,000 population. But still, the case rate is significantly higher than many of the other regions in the province of Ontario. Next slide. Looking at the weekly COVID-19 rate, comparing Windsor-Essex with the Southwestern Ontario and the province of Ontario, and as we can see that we are well up ahead of the curve with the rest of the province in terms of the case rates, and but we have seen a little bit of decline, just a 1 week decline. We still need to see the pattern where it's heading, but what we can see from the provincial average, the province continues to increase with the case rates, and would like to see that going down as well with the new measure that were implemented this week. Next slide. Looking at our wastewater surveillance data, and this is in partnership with the Great Lakes Initiative with the University of Windsor partnership, looking at the sewage data. And as we can see that in the past, there has been some correlation in terms of how much sewage data showed the presence of SARS-CoV-2 virus, and then how it is reflected in the overall case in the community. So we have seen some correlation with the high case rates and the high rates of SARS-CoV-2 virus in the wastewater. We're starting to see a stability or a decline in the wastewater prevalence of SARS-CoV-2 virus in the wastewater. So we're hoping that if our correlation and if those data are aligning well with each other, then we should expect to see either stabilization or maybe reduction in the overall cases in the region. Again, that doesn't mean that things are better and we are out of the woods. We are not. We still have a significant amount of cases in the community, and but the trend overall, what we can see at this time, based on the all this data, is maybe we have hit our plateau, and we have we should start to see some improvement going on going forward from this point. Next slide. So this figure looks at the all test and unique test individual tested by a week in Windsor-Essex, and in total, since as of January 9th, our region has tested 217,929 tests, and for the week ending on January 9th, our percent positivity was 11.4%. And again, this is a dip from the last weekend when our percent positivity was 12.3%. Last week, approximately 11,534 tests were completed just for our region, and even with the high number of tests, we are seeing more cases coming back as positive. Next slide. Our percent positivity when compared to the rest of the province, as we can see that last week our percent positivity was the highest in the province. We have our percent positivity at the second highest, followed only by Peel, and significantly higher than what the provincial average is. Next slide. This graph further breaks down the percent positivity by age group, and in the younger age group between 0 to 17, our percent positivity continues to be higher than 20%. But please note that when we're talking about the percent positivity in each of these groups, it also depends on how likely each of these groups will go for testing based on their symptoms. And as we know that there are, when children are sick, that's the time when their parents take them to the assessment center, so the pre-test probability for all these children will be high, and that's why we are seeing that a higher percent positivity in that population, but still it's significant enough for us to keep a close eye on how the percent positivity in that particular age group is evolving over time. Next slide. So a closer look for the percent positivity starting September and onwards, then how it has evolved since September. Next slide. This particular graph shows the number of daily tests completed by age group, and a lot of tests were completed among those between 35 to 64 years of age, followed by 18 to 34 years of age. And we have seen a limited number of tests, as we can see in this graph, appreciated by the blue lines at the bottom of the graph, which signifies the number of tests conducted in that age group. Again, another closer look for the same graph, and going all the way from September to present. Next slide. This graph looks at the percentage of test results that are all the test results that are available either within 24 to 48 hours of someone getting tested, using a 7-day average. Approximately, we're getting 11% of test results back within 1 day, and this is very low for our region, and makes everything a little bit difficult for case and contact management. And within 2 days of being tested, 50% of test results are being processed with the results available. Again, this is lower than where we were before, and when we get the results back in a short turnaround time, it's much easier to do the follow-up and ensuring that everything is in place. The moment all of these individuals' results are received, a team of our health from the health unit reaches out to all these individuals for the isolation or request, and to gather all the information from their contacts. Looking at the percentages of test results that are available within 1 day across Ontario, based on the 7-day moving average, as we can see, is it takes more time for our region to get our test results back based on the number of tests that are being performed, and based on the lab capacity. As I reported, more than 11,000 tests were completed last week. Next slide. Looking at our overall regional and provincial rates of cases across Ontario, Windsor-Essex continues to have the second highest regional and provincial case rates in the province of Ontario, where most of the other health units are less than or half of our case rates, based on the overall cases since the beginning of this pandemic. Next slide. So looking at our case rates by each of the municipalities, and this is a cumulative picture starting right from the beginning of this pandemic all the way up to here, and based on that, what we can see is Leamington and Kingsville, based on their population size, and the hardest hit region based on the temporary foreign workers, they continues to have the highest rates of case rates in these two municipalities, followed by the city of Windsor, where we have more than half of our population living in the city of Windsor, and then followed by Tecumseh, Essex, and Amherstburg, LaSalle, Lakeshore. So it's pretty evenly distributed in the rest of the municipalities. Next slide. Focusing just on what happens in December 1st to present, and similar picture, but more cases in the city of Windsor. Leamington continues to have the highest case rates, followed by the city of Windsor, and then pretty much similar between Kingsville and then Tecumseh and the rest of the municipalities with this case rate. Next slide. Distribution of COVID-19 cases overall. So how each of these cases were seen overall in the region. Windsor-Essex, as expected, with more than half of the population living in the city, had 55% of the cases, followed by Leamington and Kingsville, which has seen most of the temporary foreign workers, while the rest of the municipalities are pretty much the same, with 3 to 4% of cases across the region. Focusing just on the last 30 days, this is what it looks like. Similar picture with some more pronounced effect, and so that continued from the overall case rates. Next slide. In the last 7 days, similar picture, just the different numbers, but the overall ranking and the distribution of cases are pretty much similar across the region. Next slide. Looking at age and sex distribution, what we can see is not a lot has changed in the last 2 weeks compared to where our case rates were. We have seen some increase and uptake in the number of cases in the younger population in the last few weeks or so, but now it is becoming much more stabilized, and the age group that continues to bear most of the burden of disease we are getting back to similar trend with the majority of the cases happening between 20 to 29 age group, and then moving on to further on the working group between 40 to 49 and 50 to 59. Next slide. This graph breaks down the exposure history by reported date, and as we can see that we are getting cases from all the sources, including close contact, household contacts as a result of an outbreak, and occasionally some travel related cases and some of the community spread. So overall, looking at it, the trend and the pattern that we're seeing signifies the high widespread community transmission that we are seeing in the community, resulting in many cases of close contacts or resulting in outbreaks, as we have reported in our outbreak numbers. Next slide. From an acquisition source perspective, as we can see, most of these cases are acquired as a result of close contact and then outbreak related. So all of these breakdown by municipalities are presented in this graph. And as you can see, given the large number of cases, there are still a lot of cases that are under investigation, and these numbers will fluctuate based on those when those investigations are completed. Next slide. Looking at our outbreak numbers, active outbreaks, we have more than 45 outbreaks in the region, leading to more concerns from within the community with more cases. We're getting better. We're rescinding many of the outbreaks, but there are new facilities that are coming in outbreak quite frequently as well. It's really important for all the businesses, all these workplaces, all the anything that's open right now, to review your practices, review your plan, and to make appropriate changes to prevent any additional outbreaks in the region. Next slide. So our hospitalization and ICU increased quite significantly in the last couple of months. We're seeing again similar pictures that what we have seen from the cases, that it's stabilizing at the top. Essentially still means that we have a significantly higher number of people in ICU and in our hospital system, and based on the capacity, it's taking a lot of work away from the usual hospital services that they provide. Next slide. Just focusing on the 14-day average COVID-19 hospitalization, and the numbers are touching almost 100 on an average. Next slide. So this graph breaks down new COVID admission by day, and as we can see that we have had days when there are more than 15 or close to 15 admissions that happen in just single day, and that trend continues with some fluctuation, day-to-day fluctuation, something that still is concerning for our region. Next slide. So overall, looking at what is happening with all these cases, we have 71% of our cases resolved. We still see that there is a significant portion of unknown, which essentially would be individuals who are currently self-isolating, as we mentioned earlier on, with more than 2,700 people cases that are currently active, and they should all be lumped together in the group where they're self-isolating. But this particular graph only covers on those investigations that are completed and are closed in the system. So from a practical perspective, anything that's unknown, it should be lumped together with the individuals that are currently self-isolating. Next slide. So as we report a number of deaths every day, sometimes these deaths are reported to us late, and after verification of all those information, we report that. And it seems like in one given day, we are reporting many deaths, but sometimes it's just a reflection of when these deaths are reported. So this particular graph we have added just to break it down for people to see when each of these deaths are happening, just to get a better sense of the overall lives lost in our region as a result of COVID. And on an average, we can see is our people dying as a result of COVID is still significantly high in our region, but it's also a reflection of how many cases that we are seeing overall. Next slide. And among the lives lost, no change here. The highest burden of lives lost is in the 80 plus group, followed by 70 to 79. And that's why we always say the most significant predictor of people dying as a result of COVID is age. But we have seen some severe complication, hospitalization, ICU, and even people dying in the younger age group, as we have reported at least twice this year between the ages of 20 to 29. Next slide. So looking at the individuals who contracted COVID-19 and our overall case fatality rate. Our case fatality rate overall is 2.3%, which is similar to what the provincial average is. Those who are living in the long-term care home and retirement home, our case fatality rate is significantly high for just this population, which is 10.7%. And please note that this is a correction from the last week's slide. The last week long-term home, retirement home case fatality rate in Windsor-Essex is much lower compared to the provincial average. So after cleaning up all the data, this is the most recent case fatality data that we can provide for our region. Next slide. Our case doubling time, how long it's taking us to double our case rate, and the way to interpret this graph is to see that if our doubling time is low, that means our cases are increasing at a very rapid pace. And as we can see that in the month of August, September, and even October, we did very well compared to the Canadian doubling time and the provincial doubling time. And then we started to see things declining starting November and still ongoing. But looking at these numbers, as I mentioned earlier, it seems like we are stabilizing at this time. Next slide. This is just focusing on from September to today and giving a better picture and closer look on what these day-to-day variation look like. Next slide. Looking at the most recent estimated median R effective rate, and right now it is at 0.91, and as I mentioned last time, we have seen decline, but then now it's coming back close to 0.91. So day-to-day variation continues to happen with the median R effective rate. And as explained earlier, when the R naught is greater than 1, that means existing infection is causing more than one new infection. And if it's lower, that means that the case counts are decreasing. But still, as I said, we are stabilizing at this time based on the data that we are seeing. Okay, next slide. The case rates in summary, the case rate in Windsor-Essex is still higher than the provincial average, but we have seen a slight decline this week. And again, not the time to get more complacent and to start to see happiness, but I think it is important to also appreciate and acknowledge the impact of some of these restrictions that are put in place and the compliance with these restrictions. When people are complying with these restrictions, when these restrictions are in place, it helps to bring the case counts down. So that has been evidence-based, and we have seen time and time again. Acquisition sources right now is distributed everywhere between household contact, close contacts, and outbreak related, which is indicating that there is widespread community transmission is still happening. So anyone in theory, when you're meeting, they could be potentially COVID positive. So anyone you're seeing, you have to go with that assumption based on the high rates of COVID and widespread community transmission in our region. The number of active outbreak continues to be high, putting a significant burden on the entire region and from a case and outbreak management perspective. Day-over-day doubling time in Windsor-Essex continues to remain low, and again, I'll just repeat it, when the case day-over-day doubling time is low, that means we are doing worse than the rest of the region, or the province or the country. And then R not effective value is 0.91. So there's a typo on the slide. Please note that R effective value is 0.91, which is indicating a decrease in the transmission in Windsor-Essex. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Good morning. You mentioned that you are hopeful that could be plateauing and the worst could be behind us, but at what point would you be confident that this would be a trend, like after 1 week or 2 weeks?
So generally, as we know, the incubation period for this virus is 14 days, and the 14 days we start to see some result, and again, it all depends on the background case rate. So the higher the case rates, the longer it will take us to get into a situation where we start to see some results based on those measures. Because of our high case rates, I would anticipate that it would take us more than 2 weeks, at least up to 4 weeks, to really be in a position where we start to feel more comfortable and say, yep, maybe the worst is behind us and we are getting into the right direction. It's a starting trend, and I hope that the trend continues.
Okay, and as far as the vaccine, do you have any updates with the retirement homes, or where we're at? Are we still on track?
Yeah, we are on track with our vaccination. Our teams are out every day, and we hope to complete our first round of vaccination with the retirement home early next week. Retirement homes are slightly different than the long-term care home, because the long-term care home, there are regulated health professionals more in large number to support with many of the work that is needed for this vaccination. Retirement home is slightly different, and the ability for them to vaccinate and to support the vaccination program is fairly limited. But we are working really hard with the homes, and we expect to complete all the retirement home with the residents for sure early next week, and then the staff and the caregivers are also included, but either they are getting the vaccine when they are there or through the Windsor Regional Hospital St. Clair College vaccination clinic.
Okay, thank you.
Any questions from CBC?
Hi, yes, good morning. I'm wondering if you could speak about the latest in the hospital. Are we at the point where doctors here are putting together a triage protocol? I saw a story on this out of the CBC Toronto that ICU doctors are being asked to put together a triage protocol to determine who gets a bed and who doesn't. So I'm wondering, what stage are we at locally where that's concerned?
Katarina, I may not be able to answer that question. I do monitor their data, but I'm not particularly aware if they have started to implement that protocol. So I would defer that question to our hospital colleague.
Okay. Another question on another matter. Yesterday, the fire chief spoke about how recently they put together a COVID response stabilization team that responds to areas with great needs when it comes to the virus. So I'm just wondering what your relationship is to this team, and if you've been leaning on them at all in the last several weeks, and if so, how?
So as we have an IMS table with the that's led by the EMS chief Bruce Crowder, and that's supported by many of us from a provincial response perspective, and also from the local regional response perspective. When we are talking about the stabilization of all these long-term care home by providing or coordinating the need for staffing in these facilities, the need to coordinate the isolation and recovery center that's supporting the agri-farm. So all of these pieces are handled by the IRC and with the IMS, and so we do have some of those conversations at that table whenever the time allows and permits me to attend those meetings. And the pressures on the system right now, especially with the healthcare system needs, whether we are talking about the hospitals, whether we are talking about all these long-term care home and retirement home, the ability for EMS to respond to these 911 calls as needed, I think it is getting to the point that they are trying to find better ways to meet the needs of these population. So I see that as an extension of that effort to try and build that capacity, because generally some of these firefighters, they do provide that second level of support for the medical needs. Some of their staff are trained in providing some of those basic care. So I think it would be important to continue to look at the pressures in the system and to find better ways to support the needs of our community.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. Just to start off, you mentioned that our return rate for 1 day is 11%, 2 days 50%. Is there any update on the lab being established here in Windsor?
Yes, good question. So our lab is already doing all of these testing. Our local lab went through that was approved and authorized. I believe they'll start to officially test all these PCR based results starting Monday. So that would definitely give us a little bit better opportunity to get the test results back in a shorter period of time. They do have a capacity limit that how many tests that they can process, but at least having the lab in the city would alleviate some of those concerns. The same lab is also should be able to offer the rapid testing as for the identification of these outbreaks, and especially in congregate settings. And so right now there's a lot of work being done to ensure that this capacity is used appropriately and to get us the results quickly than what it's taking us right now.
So not all results will go there? Is it just like once they reach capacity, they'll be sent somewhere else, or how will that work?
Great question. I think those are the details that's currently being worked on, that how we can triage and use the lab to get maybe some of the more critical results that are needed in a short period of time versus the results that can be sent to the provincial lab or to the regional lab for processing. We still have a pretty good system in place. I think we want to make sure that with the addition of new lab in locally, all these systems are connected and they're talking to each other properly. But a lot of that work is, again, happening through Ontario Health, and they are coordinating all of that work to ensure that that all the test results capacity is used to the maximum.
And on another note, mentioned here, you talked about, hopeful that winter is hitting a plateau. Which key factors, what are you looking at mostly to kind of determine if that is the case?
So right now, as I said, the weekly case rates, that how we are comparing, and then the person positivity. So we have seen a slight decrease. Again, it's just a single week decrease that we have seen in both these indicators. So it's a good sign. But I think overall we have to recognize that we still have a long way to go. If you're starting too high, it will take you longer to go down. So think it about from that perspective. If you were already low, few weeks of decline, we will be in a better position. But we're really, really high. Still, our weekly case rate is up to 300. And as a comparison, I've always said that when the provincial framework came in for triggering many of these alerts level, they set an alert level of more than 40 cases per 100,000 population as a region in the red zone. We are at 300 cases, so we are more than 7 times than that with that number. So it will take us longer to get there, but I really hope that we all continue to do the excellent work that we are doing. And again, I want to credit the community for following many of these guidelines, because without that, we won't see those decline. So we just need to keep doing what we are doing right now to bring the case count down every week, and even much faster than what in the same manner, like we had a strong our case rates increased very quickly, and I would be really happy if I can see the case rate coming down very quickly too. But we just need to follow everything that we are doing right now.
Great, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. You presented a lot of data today like you do every Friday, and I'm just wondering if any of this information is particularly surprising or noteworthy to you when you saw it from your epi.
So I think, as I said, the most important data that made me happy to look at the Windsor-Essex wastewater surveillance data. And as I said, this is a research project at this time to find the correlation of finding the virus in the sewage water and how it correlates with the overall cases in the community. We have seen a pretty reasonable correlation with the increase in the prevalence of SARS-CoV-2 virus in our wastewater and correlating it with the increase in the cases in the community. So what we are noticing is, first, it is stabilized, and that now it is showing that it's in the downward trajectory. So that's I guess one of the data that I want to be optimistic that if all our assumptions and all our research is pointing out to that correlation, means that we may be getting into a better position where we should be as a community. So that's the most important thing that I noticed. And then the rest of the stuff, again, those are all changes that we see over time and time. And the percent positivity decreasing from last week, I think that's also a good indication. So we'll continue to monitor all of that data, and we'll continue to provide these updates. And as you mentioned, a lot of these data are really a lot of work that goes behind the scene to pull all this data information together. Our EPI team has been really amazing to give me all the tools that I need to help make all these decisions and recommendations for the community. And they continue to look for better ways to share that data with the community. And so that's about the data. Thank you.
And then second, Teresa hasn't been on a presentation for I think 3 days now. Is it just scheduling conflicts for her? Is she okay?
She's okay. It's just a lot of work that's been happening. So we're just making sure that we are utilizing our resources in the best possible way.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, I'm not sure if you can answer this or if you have the information or if it's even out there, but individuals that received the Moderna or Pfizer vaccine, the first dose, do you know anyone locally that the first dose vaccine didn't work for them and they contracted the virus?
It's possible that people, even after getting the vaccine, can contract the virus because it takes at least 7 to 14 days for individuals to build that immune response. And let's say for someone who contracted, who received the virus, but they're also already exposed with COVID and they're currently incubating. So despite the vaccine, they will develop the disease. So I think that's the issue. And as we are trying to give out vaccine as quickly as possible to the high-risk people, especially the facilities when they are in outbreak, and identifying and triaging and doing our best to avoid this confusion whether someone is already exposed or currently incubating, we have developed that protocol that how do we maximize the immunization to add that additional layer of protection for someone who may not have been exposed right now and vaccinate. So having said that, in terms of the actual cases post-immunization, I am aware of at least one, but not to say that there may not be others. We are trying to keep a close eye on that number, and we'll continue to populate that information, share with the provincial and the federal authorities as well, just to help them understand some of the process, some of the protection level, how long it takes, what the kind of exposure is to maybe look at more broadly at the provincial or regional strategy.
Okay, and then going back to your presentation, you mentioned 21% in the age group of 20 to 29 have got or been tested positive in the last 2 weeks. Any idea why that, when you and the team talk to these individuals, why that age group is standing out?
Well, Rob, as I said, so let's say if you have low number of people going into the testing, and the likelihood of who's going to test, so you have to compensate for that. So anyone, when they're showing up at the lab, we do in epidemiological ways, we say what is the pre-test probability for this person to be positive. And then when they are tested, then we get the final results, and somehow that validates that. For people who are already out and about, the likelihood of them coming in contact with may be high, but because they are so much concerned, they are also vigilant to go for testing. So even if they don't have the disease, they will go and get tested. And then when you use their data in the grand scheme of thing, they will contribute to the people who are negative or their pretest probability is low. But for someone who is in the 0 to 17 age group, generally you won't take them to go tested unless they are symptomatic and unless there is really concern that, oh yeah, this person met with someone who was sick, and that's why I want to make sure that my child or my son, my daughter is got their test done. So by default, because of that predisposing risk, your pretest probability is high. And when you're getting them tested, the likelihood of them coming back positive is high. So that's why you see the highest percent positivity in that age group. But again, there has to be some trigger. And if you look at that data and then you look at the daily number of tests by age group, which is the slide 16 that I presented, it will show you the number of tests in that age group. And if you see that data, the number of tests that are conducted in that age group, it's not a lot, but still the percent positivity is there. So it's a little bit difficult concept. I don't know, I helped you understand that or not, but seeing that number, a high percent positivity, obviously it's a concern. We don't like to see that high percent positivity, but there is some explanation behind that for sure.
And when it comes to the overall case counts, almost going back to questions that were asked earlier today, I know in the summertime we had the single digits, and then obviously, like you said, it skyrocketed. If we get back to, I guess, like the low 30s, 20s, or the single digits, like, do you have a goal in mind, like when you would like to see? I know the goal is to get to 0 cases a day, but like, are you? I'm not sure comfortable is the right word to use, but in the category of 0 to 10 cases a day, would that be okay for our region?
Well, I think right now, again, I have to take little gains. So I think this week we have made some gains because we started to see some decline, and even every week decline, that will make me happy. And if we get to the stage of having a case rates of less than 10 in our region, obviously that would be a great news for all of us. But I also know that it will really take us some time to get to that level. But even if consistently, if I see the decline in cases, I think that's a good news for our community.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Yeah, I wanted to ask you, often when we ask experts why our region is doing so poorly, they often point to the border. So I just wanted to ask you, we know that travelers boarding planes need to have a negative test before they can come into the country, but there doesn't seem to be the same requirement for land travel. So I'm just wondering, do you see that as a loophole? Is that a contributing factor to our cases here?
Oh, well, again, looking at all the possibility, I can see, yes, that could be something that is happening. And also, you know, when we're talking about our region and the mobility, that how people are moving from one region to another, and what's the difference in the case rate. So even the difference between what's happening in Chatham-Kent versus what's happening in Windsor-Essex, it has an impact if people continue to make that travel. So similarly, when we continue to have these travel ongoing between Windsor and Michigan, so essential workers going in for work or for whatever reason, the likelihood of them being in two different regions with different incidence rate, it makes that it tilts the balance in one direction to stabilize with all these exposure that are already happening. So when they are coming in, if there's any way to have some of those test requirement done, that would be helpful. But recognizing that the number of people that are crossing border every day and the ability for any to test them, it's not easy. We've had some of this discussion with our provincial partners as well, and that we raised that possibility. But again, the logistics of actually who is doing it, public health don't have the capacity to do it. Is it the CBSA official who will do that, or who will do it? And in this middle of the pandemic, I think there is some value to it if that's possible. and we should look at it.
Just another question out of curiosity. I think it was months ago that you were asked whether the health unit would be tracking data to reflect how the virus is affecting different races and different ethnic communities in our region. Correct me if I'm wrong, but I believe at the time you said you wouldn't be. So I'm just wondering if that's changed at all.
So you're asking if we're collecting data based on the ethnicity and reporting it back? Is that your question, Kat?
Yeah, just to see which groups might be affected more than others.
Yeah, so there are some data that collection option that's available in the tool that we use for case and contact management, and I don't know if maybe if I said that or not, I don't recall, but I would be hard pressed that we won't be collecting that. I think we do collect that information whenever it's available. I don't have a report yet to say that how it is impacting one particular population versus the other. I'll have my EPI team take a look at that data again to see if we are able to provide any further insight into it, and that would be helpful for our local planning. But right now, as we have said before, that the community transmission and everything that's happening, other than one particular group that I think most people are aware of, is the temporary foreign workers that has seen the highest burden of the disease and continues to have cases there. Generally, it's spread out pretty much everywhere, in every sector, in every community, in every ethnicity. But I'll definitely take a look at it and see if there's any data that we can pull for to share publicly.
Okay, thank you so much.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
AM 800?
No, thank you. Have a great weekend, everyone.
Thank you.
Thank you, everyone.